Good morning. My name is Carla D'Imperio. I am the Director of Family Support for the Phelan-McDermid Syndrome Foundation. And I am joined today by Ali Niemi, who I will be introducing more in depth in just a moment. This is our sixth in our Pathways Education series webinars that we've been offering throughout 2025. So these are monthly webinars with a focus on building skill for our families as advocates as they kind of go along this pathway with their children with Phelan-McDermid syndrome. So we've had a lot of different topics. And this month's topic is diving into state resources. So we will be spending some time really understanding more in depth about the types of resources that are available state to state and how to access them and help build your skill on that front. So we're very pleased today to welcome Ali Niemi. She brings both personal and professional insight to our discussion. Ali is the parent of Lila, who I think is now 10 with Phelan-McDermid syndrome. And so she has that valuable lived experience with Phelan-McDermid syndrome, but also professionally. She spent 13 years with the Minnesota Department of Human Services, focusing on housing, homelessness policy, Social Security advocacy, disability services, healthcare, and mental health support. So just a vast amount of experience on all those fronts. And currently, Ali also provides private consulting in housing and homelessness and also balances busy life as mom of three. So her experience bridges state systems and personal advocacy, offering us a well-rounded perspective for the session. So thank you so much, Ali, and welcome. And you can just tell me when you want me to go on to the next slide. So thank you.
Awesome, thanks. Great. So, as Carla mentioned, we're going to be talking about state supports today. Really, this is kind of a mix of state and federal resources that can help families and people with Phelan-McDermid syndrome and anyone with a disability with supporting themselves and kind of getting the services they need. So there's a lot within this. So we're kind of going to be pretty high level and help people kind of get started with the basics, what the different terms are, understand what services and supports might be available, and then help you find out where to get more information. A lot of the programs that I'm talking about today are really, well, first of all, they can be kind of complicated and nuanced, and those nuances often exist at the state level. So depending on which state you're in, they could look really different. There's kind of some basic federal rules that every state has to follow, but then states have a lot of flexibility in how they implement these programs. So you're really going to want to learn about where you locally, how the programs work. But hopefully this will give you a sense of kind of like the basics and where to start and some of the language to start using to get a sense of where to go for more information. Right. So this is our pathway, which works well with the pathway theme of different supports that might be available to people with disabilities and their families. And I'm going to go into kind of more detail on some of these specifically as we move on, but just wanted to give folks a kind of an idea of what the overall picture looks like of what might be available out there, what you could be thinking about in terms of supporting you and your child. So it really starts at the base level with income support and cash benefits and medical care. Like those are kind of like the two cornerstones of where the different supports that are available for folks, and everything kind of builds off of there. Within medical care, you're also going to be wanting to think about health insurance and how you pay for the health care. And so we'll talk more about that. And then from there, builds supportive services to help children and people stay in their home and live in the community. And that can include like a huge range of things, service coordination or case management. There are, behavioral health services to help folks with behavioral issues, education services, respite services. And I'll go into some of these in more detail later. So um, I don't need to read through them all right now, but to give you a sense of kind of what is out there, this is our pathway for today.
I love this slide, Allie, because it shows just how much is available, and I think it can be a little bit overwhelming, but there is so much support available if you know how to access it. So I love seeing it all kind of laid out like that.
Exactly. Um, Before I get into the specifics of some of these programs, I also wanted to mention some of the closed doors you might encounter as you're navigating the system. There is a lot out there, as Carla mentioned, but it can be hard to get to. And a couple of the reasons why is one, it's really complex. There's a lot of different programs. They're administered by different agencies at different levels of government. Sometimes they're nonprofits, sometimes they're government, and like people just don't know always where to start, what is out there, how to get to it. And so hopefully this session will help you a little bit with that, and then we'll give you some ideas at the end too about where to go in your state to get more specific information. Another thing is eligibility criteria. So within each of these programs, they all have the really specific sets of how to become eligible for the program. And that could look like income and asset requirements, different definitions of disability and need. Some things are for children, certain ages. And so that's like kind of an something you might run into is as you're looking at these programs, we want transportation, but that's not eligible or that's not available where we are because you have to have a certain age criteria or something. So understanding that like every program is going to have different eligibility criteria. Then the other thing that people run into is the application process. Um, there's often, unfortunately, a lot of paperwork. I know other people I work um, with disabilities on that receive some of these supports have talked about like this is a full-time job in and of itself is managing the paperwork, the staying up to date on the requirements, updating the different agencies you're involved with, coordinating everything. It can get um, really burdensome. And unfortunately, that's kind of part of the game as it is right now. But people do get stuck in that application process. They don't finish the paperwork. They don't, things get lost in the mail and then you kind of fall off and don't access the services. So that's an important thing to keep on top of and just know that it's going to take a lot of time and effort, unfortunately. Another piece of it is limited resources. Some of the programs that I have listed on the previous slide are grant-based programs. I work most closely with housing and related services, and housing in particular. Everything is grant-based pretty much. So, um, so organization gets a certain amount of money to help house people, and once that money runs out, that's it. So even though that resource is there, it's all used up. There's also waiting lists for a number of the programs that we're talking about. So sometimes even though the program is there, they just don't have space in the program at that time. And then finally, I wanted to mention specifically with Phelan-McDermid syndrome, a lack of fit, I guess I would say. A lot of programs are designed, for very specific populations like elderly, people with developmental disabilities, people with autism, autistic people. And given that Phelan-McDermid syndrome is a pretty rare condition, like many others, sometimes people don't understand what that means. So if you're talking to somebody and trying to explain what you need, get the resources you need, they're not going to have that prior knowledge of maybe they would with like autism, what that means for the person and how it fits, how their how it impacts them, and the resources also might not just be built for that group of people. And so that's kind of a something that as parents or somebody that's helping someone with Phelan-McDermid syndrome is going to be um, you, you're going to be kind of in an educational role to tell about what that means and how that impacts a person. Right.
I think, and with that point, we do have some resources that I might be able to send, pull some of them and send them in the follow-up email that explain about like Phelan-McDermid syndrome and autism and how that can look, and that can be supportive to getting additional services, or why ABA therapy is really important with Phelan-McDermid syndrome. We have a medical advisory about that. So I can link some of those resources that can be helpful in this type of almost like justifying the fit and that type of situation that Ali's talking about.
Yep. Great. Okay, so the first program I'm going to go into a little more in depth in is around income support and cash benefits. You can to the next one, thanks. All right, so the main federal program that supports a person's income with disabilities is SSI. This is pretty common resource that people have. No, SSI stands for Supplemental Security Income. It is administered by the Social Security Administration. So that is where you apply. You typically, every state's different, is you apply at your local Social Security Administration office or apply online. It is a cash benefit to people with disabilities who have limited income and resources. So in the case of SSI, if you're talking about your child, they will look at both your child's income if they have any, and your own family's incomes and resources, and it needs to fall within a certain limit to qualify for SSI. So if you are over the income and asset limit, this will not be something that you can tap into. As people age, once they turn 18, um, then they're no longer looking at like the family's income and resources and just the individual person's income and resources. And also at over 18, uh, adult children of adult children with disabilities can start drawing off of their parents' disability insurance. So another part of the Social Security Administration, which you may hear or know about, is SSDI or RSDI. So those are some of the terms: Social Security Disability Income or Retirement Survivors and Disability Income. And so that's the insurance program that you pay into with your taxes, that you draw for retirement or in case you become disabled. Adult children can draw off of their parents' disability insurance once the parents are retired, or survivor benefits as well. Okay, I think we can move on to the next.
So just this is a question I kind of have had, and I don't know much about SSI, but just to clarify, at 18, that's when the parent and family income goes away as a factor. Then it's just based on the person with the disability.
Correct.
Okay, that's a really good takeaway, I think, for parent
Mhm.
families to make sure they hear that.
Mhm. They will look at if you're supporting your child, if they're living with you and you're like supporting them in some way. But that's where you want to kind of like talk to an expert in this field or a lawyer to like set up a trust or different things like that, so that that is not disqualifying your child from accessing it.
Great, thank you.
Yeah. Actually, can you move up to the next one and then I want to go back to this one?
Sure.
Thanks. Okay. So how does the Social Security Administration define disability for child? So what we talked about, they're looking at both the income and assets for SSI, but then they also have a definition of disability that they use to determine whether someone counts as disabled. So for a child, that means medically determinable physical or mental impairments which result in marked and severe functional limitations. So it's all about how the person's disability impacts their functioning and their day-to-day life. And for a child, that means that they're looking at children of the same age who do not have impairments and kind of like comparing what the expectations are developmentally in terms of functioning, like how they care for themselves, feed themselves, be safe, those types of things. For adults, it's looking more at work and are they able to work and support themselves? I mean, they also look at how it impacts your day-to-day life, but the main thing that they're concerned about is that the person's able to work to the extent that they can support themselves. A piece of the definition of disability is they have a program within the Social Security Administration that's called compassionate allowance. Um, so this is when a medical condition or disease clearly meets the standard for disability, claims can be expedited and often allowed based on the medical confirmation of the diagnosis alone. So typically what they're doing is they're asking you to send information about your disability, taking a bunch of medical records. You have to fill out a ton of paperwork around how your disability impacts you day to day, and then depending on the severity of your condition and how it's impacting your life, that's how they make the decision. With a compassionate allowance, they said there are certain medical conditions that we know are so severe and impacting people's lives um, that we don't necessarily need all of that information to make the decision. We just know that because they have this diagnosis, they will qualify. And Phelan-McDermid syndrome is on that list of compassion allowances. You still have to apply in the same like way that you would for other things. It just changes how the Social Security Administration looks at the application and makes their decision, and it can go more quickly. So that is a really good thing to know. And this is all really important because even if you don't qualify for SSI, maybe you're over the income limits, these definitions and how they look at disability impact health insurance, Medicaid, which I'll get to in a minute. But I just want to mention that so you can kind of like keep that in your head that this is important for other things as well. All right, do you want to go back to the other slide? Okay, so on here I have a few resources related to SSI. The Social Security Administration has this page that really explains what the benefit, does a pretty good job of explaining what benefits for children with disabilities look like and how people qualify and that kind of thing. And then I also put on here the link to lawhelp.org, which goes to the legal aid organizations, and you can help find, or it helps you find the legal aid organization in your state. I generally recommend that if at all possible, if you can find some assistance or a lawyer for help with applying for SSI, that you do it. Um, what happens often is people don't do the paperwork correctly, they don't provide the right information, and then it gets denied from your initial application for SSI or SSDI for adults, gets denied. And then what happens is you can appeal that decision, and there's several layers of appeal within the program. And a lot of people, if you do appeal, eventually get approved, but it can take a really long time. So to avoid having to go through the appeal process, getting some help and doing it correctly at the front end is generally a good idea.
And
You don't have,
I will send
yeah, go
these
ahead.
links out too, so people don't have to feel like they have to write them down. I'll put them out.
Yeah,
Yeah.
okay, great. Um, yeah, so you you don't have to have a lawyer. You don't have to apply. You can apply on your own. It's generally a good idea. I put the link to legal aid because those organizations are focused on serving underserved populations, and so they are not doing this for profit. You will also like come across a lot of um, lawyers and law firms that do this kind of at a large scale for profit. Um, some of those are good, but a lot of them are not giving really like great hands-on assistance and kind of um, may not be the best route to go. So I would say if you do get a lawyer, kind of do your research and kind of um, make sure, that you're looking into the background and their experience and who they're helping and type of thing. All right. Move on. So next, I'm going to talk about the health insurance and help paying for healthcare. That's kind of the other big piece besides the income. So typically this means for people with disabilities that Medicaid can help pay for medical costs and health care. Medicaid is the single largest health insurer in the US. And the way it works is there are different categories of eligibility that people can fall under to qualify for Medicaid. And those are there's low income adults, children, and pregnant women. And so that is where they're really looking at people's um, a very low income limit for people living in poverty that need support and help paying for their health care. And there's no disability requirement. Medicaid also helps for low income elderly adults. The income limit is a little higher for elderly adults, and that's just typically what it is paying for things like long-term care, nursing facilities as people age. And then the last one is people with disabilities also have, there is an income limit, but it is higher than what is within that first category. Understanding that people with disabilities have higher medical needs and typically lower incomes. Another thing I want to mention about Medicaid is that a lot of states use a different term than Medicaid for their Medicaid program. In Minnesota, where I'm from, they call it medical assistance. In California, it's Medi-Cal. So you might not know that the program they're talking about is Medicaid, depending on like what they call it within your state. So just a heads up on that. In most states, children who get SSI payments, so low income payments for people with disabilities, they receive Medicaid coverage. And in some cases, this comes automatically with SSI eligibility. You don't even have to do anything extra. In other states, you do have to sign up for it, but you're kind of have already met the eligibility criteria, so you will be placed on Medicaid. To apply, you're going to need to check with your state Medicaid agency or county social services office. There is a list, I think I have later on where the different state Medicaid agencies are for each state. You can move on to the next slide. Okay, so then the other really important piece here is that there are these two programs within the overall Medicaid program that are meant to support kids with disabilities who have high medical needs, regardless of their family's income and assets. And so these are called, sometimes it's called within TEFRA, a law from I think like the 80s, and Katie Beckett is another piece of legislation that authorized this. So this allows families to get Medicaid coverage and get all the support paying for healthcare costs that you would within Medicaid, even if you don't meet the typical income and asset limits. So they're not looking at the parental income in these cases, and they're only looking at the child's income and resources. which typically is 0, but sometimes people get like kids have whatever, like insurance payments or things like that they might look at. The child must have a disability under the Social Security Administration rules. So think back to what we just talked about with SSI, where they were defining the disability based on the child's functioning compared to other kids that age. So they're using those same rules that Social Security is, and they also require a placement in a hospital. The needs would require a placement in a hospital, nursing facility, or intermediate care facility. So this does not mean that the child necessarily is currently residing in one of these places or has ever resided, but just that their needs are high enough that they could meet the criteria for being in one of these facilities. So they have some additional questions and criteria that they're looking at related to, again, functioning, the medical needs of the kid. And so it's a little bit higher than what a typical disability under SSI is um, to qualify for these, but they don't look at the parents' or family's income and resources. So if you have high medical costs and high because of the medical care and you have a lot of need for services and home, you can qualify for Medicaid, even if you have a lot of income for your child, based under these programs to help you pay for those services. Now, they don't have this in every state, I think most of them. But on the next slide, I believe, you can move it to the next slide now. Oh, sorry. In a few slides, I will have a link to that has more information about what programs specifically, what states specifically have those TEFRA or Katie Beckett ones. But before I get to that, I'm going to talk a little bit about the support services to help you stay at home. So there's like that medical care that Medicaid can pay for that we just talked about. Like that's the care that you would receive like in a hospital or a clinic, um, or possibly like in-home nursing services. But then that Medicaid specifically also pays for support of services to help somebody stay at home. And this is why Medicaid is so important because these are services that typically are not paid for through private health insurance. Um, almost never. I anyways, these are services that you're really going to need to access Medicaid for. Um, and it includes a lot of the other things that are further down this path. Right, you can move on to the next page. And these services are usually provided under the Home and Community-Based Services Program, HCBS. They're called waiver programs because they waive some of the rules of typical healthcare coverage under Medicaid. But that's the other term that you'll often hear people use. Like my kid is on a waiver, I'm on a waiver. So besides the medical care coverage, Medicaid can help you access these supports. They might things included under home and community-based services include like respite care, home or vehicle modifications, training for the individual receiving the services or family or other people caring for the individual, to help them better provide care, specialized medical equipment, personal support, like in the home to help somebody with kind of everyday activities, personal care assistance like bathing, eating, that kind of thing. And then often there's behavioral services that are included in the waivers. Waivers vary by state and are often categorized into different disability types. So in Minnesota, this is changing soon, but in Minnesota right now, they have like a developmental disabilities waiver, one for like more like physical disabilities. They have an elderly waiver. So kind of depending on the diagnosis, they might have different services available and different eligibility requirements to meet for to qualify for the waiver. Now, the primary disadvantage of the 1915C waivers is that they are not entitlements, which means that just because you qualify, you won't necessarily get one. And they can have waiting lists, and many states have very long waiting lists to get on these services. Which is why even if you feel like you don't need it now necessarily, it might be a good idea to look into what your state has available and start the application process so that you get on the waiting list, and as your child ages, they potentially qualify.
I think that a big takeaway for families on waivers is that every state is different, and if a state has more than one waiver, you can apply for different ones, and maybe one comes up, the wait list is shorter and you get on that one sooner. So fill out the application and get it going so that you have the option down the road. In Florida, our wait list is like 8 to 10 years, but
Mhm.
PMS has a immediate approval. So Phelan-McDermid syndrome goes through, but you have to know that, and you have to know how to
Mhm.
push that, because even when you call, the staff that you get on the phone don't necessarily know that. So you have to find someone to help you. It can be very convoluted, and a lot of states are similar. It's not easy. They don't make it easy to necessarily navigate it. So this is an area where if you're having trouble, PMSF can help. I can help connect you to someone in your state who understands the waiver process, and can help you with getting that move forward.
Yes.
Keep going.
Yeah. So another aspect of the home and community-based services waiver program that I wanted to mention, that is another kind of like advocacy piece that you can look into and think about, is called self-determination and self-directed services and supports. So typically what happens with waiver services is that the person has a case manager that is responsible for um, looking at all the different services that are available to that person, helping them find an agency that can provide those services, and they have a budget that they work within that they use to kind of line up these different services through different agencies. Um, Self-determination and it's called different things depending on which state you're in and kind of exactly what programs they have, but self-directed services and supports are an alternative to this traditional delivery. And so in these cases, they provide the budget, the funding kind of more directly to the person with disabilities or their families um, to allocate and hire people to provide those services their own. So it gives you some more independence and authority in terms of how your services are provided, kind of ability to hire and fire people as you need to. Um, a lot of times people use this also to support, like if a family member works supporting that person, they can kind of like pay for those services within the family, depending on different rules and states and how things have it worked out. Um, so this is just like a good option to know about, and it can really make a big difference for families to have this more control over how their services are provided. And you can look into whether your state has it and kind of what those qualifications are. So here's some resources. This is what I was mentioning before too about how to find if your state has that TEFRA or Katie Beckett program, which allows you to apply for Medicaid without having your income and assets look at it. So there's the healthcare.gov has .gov, did I say that right? Um, has some information, basic information on the Medicaid programs, which I think is a good starter. And then this kidswaivers.org is really great. That tells you whether about those Katie Beckett and TEFRA programs, and also the individual disability waivers, what each state has and how to apply for them. So definitely recommend looking at that as a starting place.
And it's so the difference between the Katie Beckett and Tefra versus the waiver, can you just describe that a little bit?
Um,
I don't think we have Katie Beckett in Florida.
so Katie Beckett and Tefra is the rule that allows a kid to qualify for Medicaid in general, um, even if their families would otherwise be over income or over assets. So that is a lot. They look at the kid has a disability. They're not looking at typically in Medicaid, you have to meet income and asset limits. They're not looking at the family's income and assets. They're just saying that this kid has high medical needs, so they qualify for Medicaid. Once they're on Medicaid, within Medicaid, you can apply for a waiver for home and community-based services. And that's what provides all those support services. So it's kind of like
Got it.
a
It's like the
multi-step
gate, the
process. Yeah,
almost like what opens the door in the first place is
yes.
that. Okay, that makes sense. Thank you.
Mhm.
Should I keep going?
Yep. All right, so now I'm gonna talk a little bit about some of the other programs and ideas for kind of how to get some of these other supports in place. You can move on to the next slide. So these are just ideas for accessing the programs. Again, a lot of these are super dependent on your individual state and what it looks like and or county even. Um, and but here are some kind of like starting places for some of these other things. So for behavioral health services, um, once somebody is qualified for Medicaid, you may be eligible for additional behavioral health services, therapies, rehabilitative services, different in-home services to help with behavioral needs. And those are typically administered through local mental health clinics. And so there's like specific mental health clinics that are like designated to administer the state programs for behavioral health services. It also, like in Minnesota, we have a county-based system, which other states do too, have county-based systems, but not all states. And so you can apply at the county for some of those programs. Some states I know that I've worked with have their behavioral health services through HMOs or managed care organizations. So that is how you access those services. Um, so those are just kind of like some ideas on how to look into other behavioral health supports. Educational services are typically through the school district. I think most parents are, generally familiar with these kind of services, like getting an IEP and stuff, but you shouldn't always like ask and like get further information in your school district for a lot of the like supports around transportation, um, other family support needs through your school district. Family training and support. I don't think a lot of people know that public health agencies have family support programs that can help people with kids with disabilities with accessing other services they need, getting like kind of like case management, that type of thing, training and support through public health agencies. So that's something that you could look into. For housing and residential programs, this would usually be like for adults. Most of the programs are um, not like based around a kid's disability, but as they age, looking into HUD, which is Housing and Urban Development Program, that's the federal agency that oversees all like Section 8 and different housing vouchers. So that is um, a good, and locally, that HUD programs are typically administered through housing authorities. You might hear it called like an HRA, Public Housing Authority, PHA, um, depending on where you live, they have different names. But a lot of the housing authorities have disability specific housing, like outside, I think most people have at least heard of Section 8, and that's kind of the biggest housing voucher and support program. But then each housing authority also often has separate smaller programs that are specifically set aside for people with disabilities and that you might not know about unless you specifically asked for those. So that is something to kind of like keep in mind as kids are looking aging and wanting to move out on their own and supporting themselves in their own place. Um, for transportation, a lot of places have, you know, shuttles and public transportation vouchers, uh, public discounts for people with disabilities. Health insurance will also, if you have Medicaid, they will pay for a lot of transportation related to uh, getting medical care. So, like, you can get your Medicaid if you're driving really long ways for specific medical care. You can get reimbursed for those costs related to that transportation, like you as a family driving. You have to follow certain rules and make a claim and that kind of thing, but it's something to look into asking your health insurance company about. And then for employment support and vocational rehab for um, over 18 folks, the workforce centers, I generally recommend they, and specifically vocational rehabilitation is the program for people with disabilities. Great. Move on. So I know this is all super complicated and people are like, where do I get start and how do I get help? And I mean, I guess just like it is, and know you're not alone and it's not anything that you're doing that is making it complicated. It's how it is. So I have a couple ideas on the next slide of where to kind of get started. Um, I would say first of all, I think the best thing to do is to find another parent, family, advocate that has gone through the system before and has been there, because they have the best tips and ideas for like how it actually works. So the more that you can connect to like parent or family support groups or agencies that like provide information for parents, I think, and make those connections, that's going to be like the best thing. Um, there is a website called Disability Benefits 101 that has really good, easy to understand information about disability benefits. Unfortunately, it's not in every state. I listed the states it's in here, but it's all really plain language and gives you great information. Then I have a couple different kind of parent and advocacy agencies listed here. And then also at the end, 211 is also a great place to start if you're not familiar with 211. It's a call center. It's also online now, that they have information about resources for like everything you can think of. You might not get exactly what you're looking for calling 211, but they can point you in the right direction. Great. Other things to think about just in learning more, again, getting familiar with what your state or local area has, but then also keeping on top of national and state trends for advocacy. And again, connecting with other advocacy groups, families, or self-determination advocacy groups.
I would just add one, I like to plug this whenever I can because I don't think a lot of people know about it, but a program it's not in every state. I have the list of states. It's in, let me grab that. A number of states. It's called PPEC. Are you familiar with that, Allie?
Mm,
I don't think it's in Minnesota. So it's in Delaware, Florida, Georgia, Iowa, Kentucky, Louisiana, Maryland, Mississippi, Nebraska, North Carolina, Ohio, Pennsylvania, Texas, Vermont, and Wisconsin. So it's like 15 states. It's prescribed pediatric extended care. So it's medical nursing-based daycare through Medicaid, paid for by Medicaid for children with medical needs. So my son goes to PPAC sometimes during the summer, not every day. He'll go on Friday this week. He goes on Saturdays, and it's a full day daycare for children with disabilities and medical needs that's staffed by nurses. So you have to justify that the person needs nursing. So it really, if the child has seizures or other medical issues, then that's what they're looking for, but it is totally paid for by Medicaid. And for our family, it's been amazing. So that's an example of a program in your state related to some of the supports that Ali talked about that people might not really be aware of. And getting it approved is hard. It's like she said, it's just, you have to go through the process and all, you have to appeal if they deny you and all of that. But for us, it's been really worth it. So there's a lot of things out there that you might not really know, and it's good to chat with other parents and try to learn as much as you can. So I mean, that was a lot of information, and I think your expertise is just incredible that how much you know. So thank you so much for sharing all of that. If questions come up, people might, I know I'm going to be sending the recording out. People might have questions. I will let you know. I'm also going to share the link to the conference session so Ali did a state systems panel at the 2024 conference along with Janet Wilson and Rick Wood, who are also Phelan-McDermid syndrome parents and professionals involved in this sphere as well. So I'll share that link because there's a lot of really great information, a lot of overlap, but also some different things in both presentations. So I'll send all of that out as a follow-up, but thank you so
Yeah.
much. I don't know if do you have anything else that you want to throw in there? I don't see any questions, like
Okay.
I said.
No, that's good. Yeah, I'm happy to help answer questions or talk with folks as much as I can. And yeah, thanks for having me and hope it's helpful for folks.
Yeah, no, thank you so much. And we'll be picking up with Pathways in September. We're going to take a little summer break, and I will be sharing in the upcoming newsletter. There'll be a survey with some ideas of session topics, or you can submit your own so we can get those sessions planned for the fall, and that'll be September through December of this year. So you all keep an eye out for that. And thanks for coming, and I hope everyone has a great day. Thank you so much, Ali.
Thanks. Bye.
Bye now.